Hello, Kirsten. How are you?
I'm okay.
I looked at the X-rays and CT scan images for Jenny. Unfortunately, she suffers from craniosynostosis, as we suspected. The images show that the suture has closed prematurely.
Okay.
Babies' skulls have openings called sutures, where they allow the brain to grow, and, you know, as everyone knows, that the brain triples in size in the first year, and it continues to grow until they're 12. So it would be helpful if I could know more specifics about Jenny's symptoms.
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Yeah, I'm sorry to hear that. Jenny has the condition craniosynostosis, but her skull shape is actually almost normal, so that may have made it more difficult to diagnose. Craniosynostosis is uncommon, so many doctors have difficulty detecting cases like Jenny's. Just to give you a little more information, as Jenny's brain is growing, it needs to be able to push against the skull bones, push the skull bones apart, give it room to grow. If there is a restriction in the growth, then the brain is squeezed, and that's usually caused by a fusion of the suture. When that happens, intracranial pressure occurs, and that can be extremely painful. So I'm really very impressed at just how brave Jenny is. She is a strong child.
Yes, that's true. She is. So, what are the options?
Well, my biggest concern is reducing the intracranial pressure at this point. We can do that with surgery. So.
Surgery? That sounds really dangerous.
Well,
my pediatrician thinks it can be fixed with a helmet.
If the cycotol suture hadn't fused, then a molding helmet might work, but not now. Every surgery has several risks, especially with head surgeries. Luckily, Jenny is healthy otherwise, so that greatly reduces the risk. And we'll double check to make sure she doesn't have any heart or lung conditions, which might represent a contraindication to surgical treatment.
Well, I'm just really concerned. What exactly will this surgery involve?
Well, there are two options. She's 6 months old, so we can go with a minimally invasive procedure, or we can go with the traditional approach. I'll explain the difference. With the traditional approach, we make an incision from one ear across the top of the head to the other ear. It's usually the only scar. Normally, the hair hides it. Once the incision is made, the affected areas of the skull are removed. We create an opening for the brain to grow. We reshape those bones, replace them in a normal position, and once it's over, incision is usually closed using dissolving sutures. So.
This sounds really difficult.
Yeah, it is. I won't lie to you. It's pretty involved. It's a big surgery, and it can take up to 8 hours. Craniosynostosis is complex, and it entails the expertise of a number of different specialists working together. After that, Jenny would have to be in the hospital for about 3 days.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely resolved. In some cases, children have a little bit of residual pain. We can normally, solve that with medications. In rare cases, there are children who need to have a second surgery, but again, that's very rare. The success rate is very high. It's over 98%. Doing this surgery many years very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
Yeah, no worries. It's important for you to ask questions. The minimally invasive endoscopic surgery is one that we normally perform when the baby is young, typically younger than 6 months. We use an endoscope to open the suture, and the surgery takes about an hour. She only has to spend about a night in the hospital. She can probably go home the next day. After that, she would need to wear a molding helmet for about 6 months. We need to check it every 3 months to make sure the suture wasn't closing early. It's a simpler procedure. It can be equally successful, especially when the baby's very young. So.
Okay. Is the helmet painful?
No, don't worry. The painfulness has nothing to do with the helmet. The helmet's very comfortable. It's custom made. Success of the procedure depends on how consistently that helmet is worn. After around 6 months, we know if the growth is normal. If it's not, then we might need to do another surgery. If so, then that surgery would be the longer, traditional one. Both types are complex, and we have to work with a team. My team includes a plastic surgeon and neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
Yeah, it's overwhelming. There's a lot of stuff to consider here.
So you're pretty sure she needs surgery? A helmet alone won't work?
No, unfortunately. She's had some fusion that has to be surgically corrected. Plus, if you wait a month, then the minimal procedure won't be an option. Jenny will be too old for that. We typically perform that endoscopy on 2 to 3 month old babies. So you should take my advice and consult some other specialists in the field to make sure you've got extra, kind of opinions out there. It's important. The more information you have, the better you'll be. So.
Okay.
I'll ask my assistant to print a list with the contact details of my colleagues for you. So.
Thank you. This is very stressful.
I understand. I'm sure this is very stressful and exhausting. Do you have family or friends to help you out?
My mom.
Good. It's good you have your mom to talk to. Get some support from her. Are there any other questions I can answer? Or?
No. This is all really helpful.
All right, well, I know it's a lot of information. Let me give you a pamphlet that has information about cranial synostosis. Again, think about it for a few days and let me know.
Thank you.
If there are any questions, feel free to let me know. Let the office know. We'll schedule another appointment and we'll address those questions, okay?